Good afternoon, everyone, and welcome. My name is Jennifer Kolker. I'm the Associate Dean for Practice at the Dornsife School of Public Health, and excited to welcome you all to the first lecture in our Population Health Spotlight Series for the 21-22 academic year. This year's theme, Climate Justice and Health, is dedicated to confronting climate change and its impact on population health. The call for climate action has reached a tipping point as the adverse effects of our warming planet, like persistent droughts, extreme weather patterns, poor air quality, and wildfires continue to increase. It has also become more evident that marginalized communities will bear the brunt of climate change, and its impacts can further exacerbate unequal social conditions. As we address this threat worldwide, leaders in this fight must consider that not all effects are felt equitably and develop solutions accordingly. We are so fortunate to welcome one of the leaders in this fight, Dr. Eric Tate. Dr. Tate is an associate professor at the University of Iowa in the Department of Geographical and Sustainability Sciences and a faculty affiliate with the Center for Global and Environmental Research, as well as serving on Iowa City's Climate Action Commission. Dr. Tate's research examines connections between natural hazards and society, with particular focus on vulnerability indicators, flood loss estimation, and geospatial modeling. Dr. Tate teaches courses on water resources, natural hazards, environmental issues, and environmental justice. Dr. Tate's going to join us with a talk for about the next 45 minutes, and then we will answer any questions we get in the Q&A when we are finished. Right now, I'd like to turn it over to Dr. Tate. Welcome, and it's all yours.
Thank you so much for the introduction. So in the next 45 minutes or so, I'm going to walk you through sort of what we know about social vulnerability to floods and how we model it. And so, but before I, the very first, the start of this, I'd like to maybe walk you through a little bit about my academic origin story. I didn't start as a geographer. My bachelor's degree was in environmental engineering at Rice University. And I went on to work for an environmental consulting company. We had a big contract with FEMA. And we went to hazardous waste sites and we took samples and we wrote reports about the toxicity and potential pathways to harm human health and the environment. So I did a lot of this stuff, right? Taking these soil samples and logging them, sending them to labs, this kind of thing. I did that for about 4 years. And then I went back to graduate school at University of Texas and I switched sort of from environmental toxins to floodplain mapping, trying to understand, if we take modeling, can we put it on the landscape in terms of a geographic information system? And if we can, then we can understand like where floods are in comparison to things we care about, like homes and bridges. I went on to work in consulting again after that for about another 6 or 8 years, working as a contractor to FEMA with another consulting company. We built this big model, this nationwide model called HAZAS, that you could use to understand a scenario modeling of different flood severities and different configurations of buildings to see what the impacts are, and you could plan better, is the idea. And I did that, and I was really satisfied with my work until Hurricane Katrina hit, and I started to get more interested much more in the social dimensions of floods. And that wasn't really an area to do in engineering. I went to South Carolina and got a PhD in geography. And there I did geospatial modeling of social vulnerability indicators, which is now a little bit more widely known, but 15 years ago, it was a really niche thing that hardly anybody knew about. So now at the University of Iowa, I've been here about 10 years, and I do all of this. I do social vulnerability modeling, I do flood modeling. I teach about toxicity in my environmental justice class, but mostly my research is at this intersections of the physical and the social. So here's just an outline of my talk. So I'm going to start with sort of helping to define what social vulnerability is. I think we're going to need to do that if we're going to understand like the modeling aspects of it, measurement, some of the big challenges and questions that are associated with it. And then taking this analysis to the next level, not just thinking about social vulnerability, but social vulnerability to floods. And then, how does this understanding help us address some of the big questions today around equity, and justice when it comes to flood hazards. So I think I'll just start off with, looking globally. We're seeing just some clear trends in terms of disasters. So disasters are essentially extreme hazard event that overwhelms the local capacity to deal with it. And so this is a report from the World Health Organization um, looking at changes in disasters from 2 decades, the 80s and 90s, 2000 and up to 2019. And what we see is, they broke this down into different types of extreme hazards and their origins. We see like floods are dominating. And I think over this time period, there's something like a 45% increase from these 2 decades in floods. And in severe storms, I think it's like another 25 or 28%. So severe storms can also generate flooding. The long and short of it is that climate disasters are really increasing in their impact. And among those, it's water that's causing the most impact. We see some of the rising trends in sort of climate related disasters. NOAA tracks what they're calling billion-dollar disasters. So disaster events that cause, $1 billion in loss or direct losses, I believe. And they started tracking this, I think maybe 2009, 2010. What you'd see is every year there'd be like 8 or 9 of them. And now we're up to like, 20 or more every year. This is latest in 2020. And you can see like it's dominated by climate related disasters, severe storms, tornadoes, hurricanes. This is what's dominating. And you can see this in the record of major disaster declarations. So what I'm trying to lead you through is like there's different ways of looking at this, right? We can look at like the number of disaster events. We can look at like the economic loss. That's going to tend to favor places that have a lot of stuff that can be destroyed. We can look at the number of major disaster declarations. This is in the United States, which allows sort of the flow of federal resources from to the local areas that are impacted. Over time, in this record, I think it's 62% of all the disasters are flood related. So globally, economically, here in the United States, impact floods are dominating. But, providing, having programs that provide disaster assistance, it's not sufficient, right? We can't just focus on trying to fix problems after they've happened. But that's where the bulk of our resources go. And so even places that get full resources don't always fully recover. And there's a lot of disasters that just don't get the resources they need. So here just in Iowa in the last couple of years, there's a big tornado event where FEMA, the presidential disaster declaration was denied. So what happens to these people that have lost everything they have and likely uninsured or underinsured? We had a big derecho event. I don't know if any of y'all heard of this about a year ago, where it came through and just basically like 100-mile-an-hour straight winds that were here for about maybe an hour. It was something else. And it led to a lot of downed trees and destroyed homes and stuff like that. And, federal assistance wasn't fully achieved there either, right? And I think it points to the sort of the multidimensionality of floods. So back in my days in engineering, the way I saw floods was about the water. And so we'd model it through all sorts of flood characteristics in rivers, floodplains, and cross sections, and velocity of water and duration of flooding. And, this is sort of how I conceptualized floods for a long time. And this is where we put a lot of resources too, in terms of modeling for floods. The general idea is like, if we have a better understanding of how this water flows, we can manage better to reduce the impacts. So here comes into place for the disaster management cycle. So thinking about activities before disasters, like mitigation and preparedness, things after the disaster response and recovery, and flood insurance. All of this is wrapped up in management. And so when I worked on this FEMA model, it was this intersection here. But over time, I came to understand, no, there's actually more. It's actually these sorts of impacts, the flow of water and disaster management the benefits, the faults are not uniform across populations. And so there's this social dimension as well, that, extremes of age and exclusion and health, language proficiency, all of these matter, that you could have the same place and people experience disasters very differently. The problem is there's all sorts of resources at the federal level and state level, programs, expertise that goes into physical and management. Hardly any relatively goes into sort of social, okay? And this really broke down with Hurricane Katrina, where it really highlighted this need to understand social dimensions, right? So we had these levees fail. There's all sorts of analysis. I was doing just crazy analysis for FEMA at the time, trying to give them updated information. And a lot of this is focused on traditional quantitative measures like probability and risk, really sees sort of water and structures as a central challenge around flood disasters. But Katrina showed that, well, no, it's people. And in this large American city, we had over 1,000 people die from a disaster event that was entirely foreseeable. I mean, FEMA had planned for years, terrorist attack in New York, earthquake in San Francisco, hurricane in New Orleans, but yet we were completely unprepared, largely because, we didn't put that much focus relatively into warnings, evacuation, shelter needs, recovery planning, identification of susceptible populations to the degree that we put into social and physical and management dimensions. So if you take sort of a social focus lens on some of these same problems, so this is a Coralville Dam, which is right upstream of Iowa City. We had a huge flood in 2008 where the dam, this is water going through the emergency spillway. The water was so high. And so we put these big protective structures, levees and stuff, and we say, look, we're going to protect this many acres of land, or we're going to reduce the amount of flow. And these are measures of sort of success and evaluation of these projects, okay? But it doesn't really tell us who is protected. So we're missing something. We can talk about trying to evaluate projects based on the economic benefit cost ratio, for example. That's a big thing in sort of, federal funding. This is Katrina showing, levee broke on one side, but not on the other. We had the same similar issue in Cedar Rapids, which is upstream in 2008, where in the aftermath, the city wanted to provide federally supported protection from flooding. On the east side of the river is a central business district, hospitals, high value properties. On the west side is workforce housing, older populations, lower incomes. Through benefit cost analysis, the east side of the river qualified for federal funding. On the west side, it did not. So, doing things just on economic basis is likely to miss sort of social dimensions. What is it that we value the most? Whose homes are bought out? Big thing right now is thinking we can reduce impacts by buying out damaged structures so that next time the flood comes, it won't be an impact. But whose homes are we buying out? There's lots of recent research that is showing that it's actually the wealthier counties that can qualify for these programs because they have the management and technical expertise to manage these programs. But then within those places, they tend to fund buyouts in places of more vulnerable populations. So, it's not just thinking about the economic benefit costs and ratio here in terms of whether a buyout program is viable. There's other dimensions we need to think about. This is Terry Cannon. He's a political ecologist and geographer. And his argument is one that's, not uncommon in the disaster field, is that it's actually, disasters are a result of pre-existing conditions, okay? It's unequal access to opportunities and unequal exposure to risks. That's why we have disasters. It's not so much because of, it's certainly due in part to the hurricane or the water or the wildfire, but it's actually our social development that matters a lot. He contends, look, it's more important to discern how human systems place people in relation to each other than to interpret the natural systems. But right now we're doing most of the stuff on interpreting the natural systems. And that's given us some blind spots. So for example, most of our disaster programs will send money based on destruction of assets. So cities get money for, wastewater treatment plants and stuff and debris, which makes sense. But households get it for damaged homes. So if you're a homeowner, the bulk of resources, National Flood Insurance Program, FEMA Individual Assistance Program, the Small Business Administration disaster loans, the Hazard Mitigation Grant Program from FEMA, the HUD CDBG program, all of these favor resources to homeowners. Okay, so there's an argument to be made for that, but we can also look in our, over the last generations and even currently, there's tons of evidence even today about rampant racial discrimination in housing from all of these processes over time, some of which are continuing to this day. There's, reports just coming out in the last month about disparities in appraisals, reverse redlining, this kind of thing. All right. So if we're putting all this money into homeowners, but yet we have big gaps in home ownership based on race, then we're not distributing our resources equitably. And so that's just one example of sort of how disparities play into social vulnerability. And so the general idea behind this concept is that there are some population groups that, due to sort of chronic conditions, face greater harm from disasters than others. So think about, you got flooding that you can look at in terms of X and Y, latitude and longitude, on the ground, like Z dimension is depth. Another way to think about it is the Z dimension is social stratification. And whether it's people living in poverty with chronic health issues, renters at extremes of age, those with lower English proficiency, and certainly race and ethnicity, time after time, we see that there's disparate impacts when it comes to disaster. So social vulnerability research tries to understand not only who those populations are, but the underlying processes. So why should we even focus on vulnerable populations? Tying into climate change and this rise of climate hazards, vulnerable populations worldwide are at the greatest risk, tend to inhabit lower lying areas, marginal lands, more often have fewer resources to cope when they are impacted. By deploying resources to help vulnerable populations, you can help more people than with sort of wealthier infrastructure-based focus. So it can be really cost effective in terms of the numbers of people. And I think it's not too difficult to argue that many of these populations are least responsible in terms of climate emissions for the underlying sort of physical causes that are resulting in greater climate hazards. And then taking off my scientist hat for a while, I would just say, like, it's morally the right thing to do is to focus our efforts on those who need it the most. So, okay, we have this general idea. How do we go about then measuring this, right? If we want to put it into policy and practice, we need measures. And so this is where sort of my work in spatial indicators come in, with the underlying premise that, like, it's measuring things helps put it into management processes. So, we've seen tons of COVID-related maps. This is, I guess, COVID susceptibility, where they put together some demographic factors and came up with some susceptibility map. And I think, taking these things and mapping them can be really effective. We can, people are visual creatures. And we can start to identify places we might want to target, or maybe even start asking new questions like, why is West Virginia coming up so high? What's happening in Southwest Alabama, where this higher susceptibility? So all sorts of uses for these spatial indicators. I'm going to focus in this talk mainly on these two of like prioritizing projects and allocating resources, because that's where a lot of attention is right now, especially with the federal government. So there are some existing measures of social vulnerability that are well known. The first is the Social Vulnerability Index, or SOVI. Came out of University of South Carolina. Yes, this is where I went to graduate school. I went to go, my PhD advisor, her lab came up with this measure like back in 2003. And so you can map social vulnerability and look at its patterns. So the reds are the top 20%. So Rio Grande Valley, upper plains might come up as more socially vulnerable, this map. The Centers for Disease Control, they have their own model called the SVI, also the Social Vulnerability Index. The South Carolina model has like 29, 27 variables. CDC model has 15. They've grouped into these themes. They say these are the drivers of social vulnerability. HUD, through the Community Development Block Grant Program, they use a single indicator of low to moderate income population. So they tie sort of vulnerability to income. And they use this to prioritize resources with their disaster recovery programs. So these are some of the major indicators we use right now, but I think they have some pretty big deficiencies. So we studied this, I did a paper a few years ago looking at Hurricane Sandy and trying to understand sort of the validity of these measures. And so we tested all, well, not the LMI, but the SVI and the SOVI. So these models are pretty much descriptive. So they take case study work, they look at populations that are identified in these disaster case studies, go to the census, get demographic variables that represent these dimensions, and then assemble them into a model and declare victory. They differ a little bit in their methodology, their statistical methodology. So they're descriptive, but to what extent are they explanatory? Our work found that they're not very explanatory, or it's questionable explanatory power. None of them are focused on a particular hazard. None of them are focused on a particular aspect of the disaster management cycle, like pre or post. But yet they're being sort of marketed and sold as measures that we can use for anything. So this is language from the CDC saying their model, they can use it for emergency response planners, public health officials. So these are the target audiences. And it can be used for identifying issues before a disaster, during a disaster, and after disaster, right? So it's really flexible in how it can be applied. At least that's what they're claiming. So other work, sort of leading questions in this is like, okay, if we have this, we agree on this notion of social vulnerability, what should we be looking at in terms of trying in measurement, which indicators? And so we did a big lit review maybe 5 years ago, looking at qualitative case studies. And we started by searching for a lot of these indicators we see across studies. So some thematic indicators and a bunch of specific ones. So anytime we'd find one of these in the study, we'd sort of, in an A study, we'd mark it in a matrix. We had 67 studies we looked at. And what we found is like some of these drivers, right? These thematic indicators are reported more often than others. So you could look at the frequency, and these are ordered here. So you might conclude that demographic characteristics are a bigger driver of social vulnerability than, say, whether you own your land or not. But we also found that there's quite a bit of interactions. So for example, this driver of land tenure is highly interactive with others, meaning that the studies that found like coping capacity to be a big driver also found in these same places that land tenure was an issue. So land tenure acts in a way that's interactive with other drivers, so increasing the complexity of it. How do you represent this in models? We also found that disaster stage matters. So for particular indicators, it may be useful for describing social vulnerability pre-disaster, but maybe less useful for describing vulnerability post-disaster. And so, the use of the same measure for pre and post-disaster conditions maybe isn't useful. And then sort of national income matters was another finding, right? But really, I think these two about these interactions in the stage of disaster. Another big challenge is scale. Okay, so we can get demographic data from the census at many different geographic scales, ranging from counties, zip codes are smaller than counties, tracts combined to form counties, so block groups combined to form tracts, blocks combined to form block groups. And so, if we want to have really highly resolved information, if we want to use this with other data that may be available at local scales, you might want to try and do your analysis at block group level. But there's challenges with the data itself in that the accuracy is, as you get smaller and smaller, the accuracy of the demographic estimates, the inaccuracy increases. So there's this tension between trying to get small for higher resolution, but trying to stay large for accuracy and precision, right? So that's a big modeling challenge. So what scale do you use? And then if you do all that and you have your measures, how do you validate them? Well, typically we want to see if the places we predicted to be vulnerable actually show up as vulnerable after a disaster. So we want to use some sort of disaster outcome data. Okay, so what should we use? We did our study of Sandy. We looked at 4 indicators from FEMA: the number of applicants to the individual assistance program, the number of renters that were affected, damaged housing units, and economic losses. And we found that the predictive explanatory power of these indicators varies depending on what outcome measure you're looking at. So it really needs some additional thought of, like, if you are vulnerable, then what? Like, what outcomes should you expect to have if you're vulnerable? Which of these are most tied to this idea of social vulnerability? Even if you have an idea, you know which indicators you want, they may not be available, or they may not be available at the scale you want. We get flood data now, like 3 by 3 meters cells, but if you're trying to do demographic analysis at the census tract level, there's a big mismatch. Which programs to look at, because they do different things, federal programs, and what measures within them. All sorts of challenge with geospatial analysis about ecological fallacy and multidimensionality. So really, what is a valid measure? And what kind of explanatory power do we get that says, yes, this measure is valid? We don't know, but yet we're deploying these measures. So I think there's some problems right now. We're getting a little bit ahead of ourselves. I believe, and from our work, looking at these really big meta-analyses, that social vulnerability to floods is actually different than just social vulnerability to disasters. So a lot of my work focuses on narrowing the context of social vulnerability modeling to floods. And so GIS is really well suited to do that, because you can represent these multiple dimensions with geospatial layers, and then you can put them on top of each other and see how they intersect. So this is research after Hurricane Katrina, where they had flood depth, where they mapped across the city, and then built a social vulnerability index and mapped that across the city, mapped them each in 3 different categories of low, medium, and high. We can look at these visually to try and understand how they correlate, or we can just put them on top of each other and have like a 9 by 9 matrix. So if you're just looking at the physical dimensions of flooding, let's look at this flood inundation. You might look at the gray, the light blue, and this blue here, and these are the places that we prioritize based on flood depth. Now, if you add this other dimension of social vulnerability, now say you look at the dark gray, it might draw attention to other places, and these other places may have different needs. So just by adding another dimension, it can really change how you try and manage a flood or plan for a flood. Okay, it's directing us to different places. And so with social vulnerability research, at least the way that I see it, there's some larger questions. There's a lot of stuff that I do. Like, we can use these models to understand which places are the most socially vulnerable. We can look at these places and figure out who. And then if we have valid measures, we can start to try and understand to what extent disaster management is equitable. So for example, I was talking earlier about the mismatch between programs that are giving a lot of money for damaged housing and historical discrimination in housing that's led to really big gaps in home ownership. And also, how do these multiple dimensions interact? Right? Let me give some examples. And so which places? That's kind of the easiest. Once you start to getting into interactions in multiple dimensions, it gets a little bit more difficult. But it's good that more and more research is entering this realm. So some of the importance of this work was highlighted in a National Academy of Sciences study that I was fortunate enough to be able to participate in a few years ago. Framing the challenge of urban flooding in the US, we went to Baltimore, Chicago, Houston, Phoenix, and we talked to people about data, about physical infrastructure, about social dimensions of flooding, nonprofits, for example. And some of the major conclusions was when it comes to the impacts of flooding, certain populations get disproportionate impacts. When it comes to who lives in the floodplain, also certain populations, disproportionate impacts and some overlap, right? You see a lot of these characteristics were shown in the table I showed you earlier about social vulnerability. So we embrace and start on a study that just got published in January, looking at sort of these multiple dimensions. And right now it's cool as a flood modeler. 15 years ago, it was really difficult just to generate flood surfaces, geospatial flood surfaces. You had to go through this entire huge modeling process. Now, there's been new continental scale mapping that's just come online in the last few years that it can just get a flood map for the entire United States. This is a fluvial map of the 100-year flood, so flooding from rivers. It's a pluvial flood map here on the right. This is flooding from intense localized rainfall. They're not always the same places, okay? This pluvial dimension is not something that's reflected, say, in FEMA flood maps. It's not really a part of most analysis, but yet it's a reality. So we have better flood data now. We can model this quite easily. So what we did is we combined these fluvial and pluvial grids to get at the physical dimension. We built a social vulnerability model for the United States, the census tract scale, to model social dimensions. So here we see patterns in the desert Southwest, maybe the Pacific Northwest, Rio Grande Valley, Black Belt region of the United States. Okay, so we have a geospatial representation of social vulnerability. With those combined pluvial and fluvial grids, we used remote sensing data to find the places that flood that also have people, okay? And built a metric, essentially the percentage of each census tract that's habitable, that's people live in, that's also flooded. And so we get a different pattern highlighting the Central California Valley, certainly the lower Mississippi River Valley, the Hurricane Coast, Red River, the north. I'm here in Iowa right here. And so the Missouri River's on our western border, Mississippi on our eastern, some flooding there as well. And then we use sort of spatial modeling technique. This is basically a spatial clustering approach called bivariate LISA. Essentially, it's telling us the places that have high flood exposure that are surrounded by places that have high social vulnerability. And we have some spatial contiguity here. So we have some clusters. And that's what's shown in the red. Places that are high sort of in their distribution, individual distributions, but also spatially contiguous. And clearly, this Black Belt region, the US and the Atlantic coast and Gulf Coast coming up the highest. The other I want to draw attention to is the high-low. This is high flood exposure surrounded by low social vulnerability. Now, high and low here are relative, okay? There's no absolute measure of social vulnerability. So we measure it in a relative sense. And when we do this, we can get a different picture of the sort of the multidimensionality of floods. Here, we look nationally, the population density, for example, in these high hotspots is much lower, 73 people per square mile than the national average. By contrast, the high flood exposure surrounded by low social vulnerability, much more high population densities, so more urban areas. A lot of these are being picked up in the Northeast, where the census tracts are a lot smaller, high population, but you can't really see them on a national map like this. So we did a few cutouts for cities where you can see these spatial distribution, St. Louis, Chicago, Phoenix, Houston, and you can also see sort of this clustering in these cities as well, okay? So this helps us try and understand like where, like from multiple dimensions, the most vulnerable places are. We also want to understand like who is the most vulnerable. So we looked at these demographic characteristics. These are all the 29 variables that go into the social vulnerability model. We said, if we look at the high places, what's the percentage of all these variables? That's in this column. Everywhere else, what's the percentage? And we looked for the places that had the biggest deviation. So if you're going generally from any place into a high cluster, the percent mobile homes increases by 250%. Is the biggest change. And likewise, big increases for Black and Native American populations, decreases for wealthy homes and Asian population, huge decrease in median housing value to the tune of over $150,000. And so we've ranked these by percent change. I did not expect this to happen. Most of the stuff in social vulnerability, you find it's race and class are dominant. Here is actually mobile homes that was clearly the biggest change factor. So that led me to new questions like what's going on with mobile home that makes these places more vulnerable. So we average the high-low and the high clusters and we rank them. These are the ones that have at least a 40% difference. And so a lot of people think about social vulnerability, they immediately think about poverty, and that's important, but it's not actually the leading indicators, which are actually housing and race, okay? So we can have an understanding of the places and which characteristics have the biggest disparities, but that's not enough either, because I'm kind of dissatisfied with a lot of the focus lately about just finding population disparities and then just leaving. Like that's the end of the analysis. But why are these disparities existing? You know, we can have sort of technical fixes, maybe with programs that maybe help things on the back end. But if we have an understanding of like how these disparities are being generated, maybe we can fix them on the front end. And how do these disparities relate to the physical characteristics? I think we need a lot more integration of qualitative and quantitative research to help unpack this. And right now, there's such a huge dominance of quantitative. And it's coming from somebody who was a civil engineer for 15 years, right? I'm probably the unlikeliest messenger for that. So some of the implications of this study, well, there's around 19 million people in these high hotspots. These places are more rural, they're more socially vulnerable. In flood mitigation, we apply a lot of these approaches to reduce impacts. But there's real questions, I think, on like who benefits from these mitigation approaches, right? So this is a cartoon from the U.S. Army Corps of Engineers. They say, look, we can do all these interventions. We start from a high level of risk, and we can have zoning rule ordinances and good risk communication and structural stuff like levees and flood walls. And in the end, we have this low level residual risk. That's overall. That's the aggregate thing. But who is this lowering of risk apply to? Does it apply to everybody or not? And so I think we need to embed social equity into this calculus, which is completely absent from most of the way we think about reducing flood impacts. And so how can we do that? All right, so I'm going to go back to this cartoon. Many of y'all may have seen this before. I use it for my environmental justice class. About thinking about sort of the difference between equality and equity. These people are looking at a baseball game, which I would say is sort of an amenity. You could also say that protection from floods is an amenity. And so the people in the stands, they paid a ticket and they have a front they have a good view of the game. You could have an analogy that, places and people that pass this benefit cost analysis thinking, they get the flood protection. But then there's others that don't, that have more difficult access to it. Okay. And so you can think about populations, blue, red, and yellow, that because of this, varying landscape, if we apply a quality lens to try and get resources to help these people that don't have flood protection, we give the same amount of resources to all, that's not actually going to get everybody protected. Or if you apply an equity lens, where we focus on the people's needs and we deliver more resources to those with the greatest needs, then we can protect everybody. Okay. I would say like this is certainly a better approach than equity for helping more people. But there's still the problem of like, why are this fence exist? What are the barriers here? These are barriers in our socioeconomic system, like Terry Cannon would say. And so ultimately, if we want to get environmental justice, we need to take down these barriers. Okay. And lots of agencies are interested in doing this. I kind of like did my research and I did well. I got tenure. I was part of my subgroup in geography. I was the chair of my subgroup. I was doing sort of traditionally I was doing well. And then like over the last 2 years, it's just like exploded in interest. So this slide includes all the groups that have asked me to talk to them over the last, 14 months. Trying to understand like, we've been doing things a certain way for a long time. How do we introduce social equity into this? Because we need to do it like now. And so you have all these agencies that for a long time in their mission, like social equity is not a part, but now they're trying to make it to integrate it into the way they're doing things. They just don't understand it. And it's been pushed forward even more by the new President Biden. One of his first executive orders was to think about these disparities. And so every agency had to look and see how they're doing with respect to that. But I would say like for the most part, the agencies are filled with people that have never done this. They haven't had this training and now they're trying to make a focus and they're still trying to figure out like where to start. And so I think spatial indicators are useful for this. Certainly thinking about now these focus on allocating resources. I've learned that the federal government used the CDC model in allocating resources for COVID. Like they all of a sudden, we need a measure of social equity. This is what we have off the shelf. Let's take it. Right. But I think if we go forward, we need to have more tailored measures, especially for flood. And so I think there's at least 4 big needs. We need to have a better grip on vulnerability processes, not just examining the disparities they create. How do these, which impacts, which populations, where? And using that understanding then to select indicators, right? So it's sort of empirically supported. And then if we want to do sort of validation studies to see how they're doing, which program outcomes align with this idea of social vulnerability, we need more local scale indicators of race, particularly. You can look at these program applications and ask people what their income is, do they rent or own. So you can get some demographic data. They don't collect on race, mainly because it's not been in the mission of these agencies, or it's been, they're not allowed to do it. And a lot of these data, what they have is sort of wrapped up. It's difficult for researchers to acquire unless they decide to reach out and give it to you. I think we also need, while we're doing this, to find ways reducing disaster impacts to enhance local capacity. And as we're doing all of these top 3, periodically we need to evaluate performance. And so I think, some approaches, more qualitative research, more integration with quantitative, and I think not just econometric modeling, but spatial econometric modeling is really useful. So trying to understand vulnerability processes. This is Terry Cannon and others this is like probably the most cited book in hazards geography. And they contend that disasters, certainly precipitated by hazards, But really it's these social characteristics. So the risk in a disaster is this combination of hazards and unsafe conditions, these proximate conditions, physical environment, economy, social relations, right? But if you try and understand, like, why are people living in dangerous locations and why are these special groups at risk? Well, it's due to these dynamic pressures that are larger scale processes like urbanization and population change and migration and deforestation. But then, what's driving these processes? And it's really about power relationships and political economy and ideologies. These are actually the root causes of vulnerability. And what they contend is that disasters create this pressure. And if you want to release this pressure, then you need to decrease vulnerability. So it's putting more attention on the social characteristics and social processes than the hazard processes. One of these we have a lot more agency and control over than the other. Okay. So we now understand vulnerability processes. We're just we had to revise and resubmit. I think this paper is probably going to come out in a few weeks. Huge meta literature review of both gray literature and academic literature. So gray literature from, nonprofits are doing reports, or governments are doing reports, and trying to understand in flood recovery, as people are trying to get access to disaster programs, who's the most vulnerable, who has the most adverse impacts, who has the most difficulty recovering. We found 4 main populations: renters, this under prioritization versus homeowners, and you can have sort of longer term impacts with rental housing markets become really expensive, and that can also lead to permanently displaced renters. It's the slow motion part. Racial and ethnic minorities, these discriminatory housing policies that we're still dealing with the legacy of today, and populations with low English proficiency, coming out prominently in these findings. Low income households that get rejected for assistance at higher rates. And this has nothing to do with, like, when controlling for damage levels. And longer term sort of negative impacts on financial health, which oftentimes isn't all that great going into the disaster. And then, so I said, this 4th population is this intersectional populations. So intersections of, poverty and race, poverty and home ownership, that these are actually distinct populations in themselves. So if you look at, like, low income minority households, they have very different outcomes than minority households or low income households. So we need to expand our thinking a little bit to think about populations as sort of intersectional, because they have different sort of outcomes and different needs. So this is New Jersey's doing this, right? They have this overburdened communities. They're trying to devote more resources to environmental justice communities. So they've identified a few variables, and so they've got some combinations here, right? Low-income minority, limited English proficiency. I think they're doing, one of the more forward-looking states and trying to deal with EJ. A colleague and I, we just had a little, what's it called? Perspective piece earlier this year, where we looked at nationwide the counties based on disaster losses, and we split them into 2 groups: counties that have above average disaster losses and counties that have below average disaster losses, and then seeing what the demographic characteristics, how much different they are between these groups. We find for these single indicators like of race, ethnicity, and poverty, not a whole lot of difference between these high loss counties and the low loss counties. But when you have these intersectional characteristics of race and poverty, for example, then you see big differences between them. But unfortunately, like, a lot of our analyses is still focused on these single populations, where I think really there's more that we don't understand in these intersectional characteristics. While we're doing
Dr.
this,
C,
yep, I got
just
5
giving you
minutes.
your time check for the Q&A.
Thank you. So another approach is to integrate equity. We're seeing this in a lot of research programs now. It's trying to do transdisciplinary research, doing research with communities, not just research for communities. So this is an example of a nonprofit called the Anthropocene Alliance, that they help connect local grassroots groups that are trying to have more local action on persistent flooding. Give them technical resources, help them get grant money, connect them with pro bono hydrologists and lawyers through this AGU Thriving Earth Exchange, helping to reduce this deficit in trust in many of these communities, right? So I call AA, Intersectional Alliance, sort of a connector organization. They help connect management with local communities, okay? It can be both a top-down and a bottom-up approach. And finally, trying to integrate equity modeling at local scales, right? We're having more and more data. We have a better idea of unmet needs, but we don't have a great understanding of how equitable our current programs are. So how can we try and figure out remedies if we don't have a handle on this? There's many different ways to look at this. But we do know that, like, if we keep doing the things the way we're doing it now, the inequities are likely to continue, which inequities are being found in study after study after study, right? Federal agencies, university researchers finding the same kinds of things, right? So we can, by introducing social equity, we can have flood protection that provides equal protection. We can satisfy human needs, right? Additional criteria. Harris County, which is Houston, they now, in their decision-making for which mitigation projects come first, they've introduced social vulnerability factors, 20%, okay? To try and have this multidimensionality. There's actually been some pushback from this, right? New York Times frames it as a climate plan in Texas focuses on minorities. Not everybody likes it. I don't agree with the way they frame this. 20% is not focusing, I don't think. And social vulnerability is not just minorities, it's multidimensional. I hope I've made that case during this talk. But you can see, like, even sort of a modest change faces headwinds, okay? And we don't even know what the best practices are. Harris County is just trying something. Most places aren't doing that. So where do we stand? We do know that there's major inequities in exposure before disasters, recovery after disasters. If we don't do anything, they're going to just keep going. We can try and understand social dimensions better using spatial indicators by modeling social vulnerability. And if we have valid measures, we can use them to evaluate equity in mitigation and recovery programs. Okay, so some of the stuff I'm doing now with some colleagues, we're looking at sort of what's the connection with historical redlining and current patterns of flood exposure and who's impacted. We're looking at household level scale, so going way below census tract and block group to households, for looking at individual assistance after Hurricane Harvey in Houston, and we're doing some national level agricultural flood risk modeling. Okay, so hopefully after this talk, you have an decent understanding like what social vulnerability is, how we can measure it, some of the big challenges in trying to do so, how we can sort of narrow context of social vulnerability to floods, and then maybe apply it to have a better understanding of equity and reduce inequity in programs. Okay, so thank you for your time. It's been great presenting to y'all, and I am open to having any questions that y'all may have. Thank you.
Thank you so much, Dr. Tate. That was terrific, really. I think it gives a lot of us in public health some real thinking about how we fit in, as you said, to sort of different sectors, and hearing how many other people are how many sectors are starting to think about this is encouraging. So if there are any questions that folks, right now, there's nothing in the Q&A. Do people have any questions for Dr. Tate? Well, it looks like you have just left us with a lot to think about. So thank you, everyone, for joining us. Dr. Tate, thank you so much. I know you've got some time with faculty later today. And oh, wait, we've got someone just popped in. Oh, no, not a question, but what a great talk. So that was the comment. So thank you again very much. Thank you for meeting with our students earlier today. And I know you're meeting with our faculty later today. And I look forward to future collaboration. Thank you, everybody, for joining. And please join us for the rest of our series throughout the academic year. Thanks so much.